Ya, Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera buat kita semua. Good morning, everyone. Senang sekali hari ini kita bisa kumpul ya hari Minggu. Biasanya kalau nggak masa pandemi kita sama keluarga gitu ya. Ini tetap bisa sama keluarga, tapi kita dapat ilmu nih ya, mau sharing. Nah, kami dengan bangga sekali dari InWOCNA DPW DKI Jakarta akan menyelenggarakan international webinar dengan tema Pressure Injury in COVID-19 Pandemic, a Comprehensive Update, Prevention and Management, Tips and Triknya. Oke, rekan-rekan sekalian, pagi ini saya sangat bersyukur sekali bisa secara online ketemu dengan semua yang saya lihat di chattingnya peserta masih terus berdatangan ya ke dalam website kita ini. Nah, untuk pembukaan ini saya pertama-tama ingin menyampaikan dulu kepada semua speaker kita yang luar biasa. Yang pertama ada Dr. Emily. Dr. Emily, beliau adalah asisten profesor di Curtin University. Nanti saya akan bacakan CV-nya lebih jelas, tapi ini saya sapa dulu ya. Hello, Dr. Emily. Welcome to our international webinar. Dan pembicara berikutnya ada Ibu Eka dari Rumah Sakit RSCM dan Bapak Adik juga dari Rumah Sakit RSCM. Oke, untuk mempersingkat waktu, saya juga ingin menyapa nih para audiens yang sudah masuk, luar biasa sekali. Ini dari berbagai, hampir seluruh kota kayaknya di Indonesia ya ada. Terima kasih sekali atas antusiasmenya yang mau mengikuti webinar internasional kita hari ini. Nah, dari luar negeri juga ada nih kita, dari saya sebutin ya, dari Australia, ada yang sudah masuk, Malaysia, Saudi Arabia, Prancis, dari Eropa, Prancis, Belanda, Taiwan, dan Brunei Darussalam. Thank you sudah bergabung di webinar internasional kami. Oke, tanpa memperpanjang waktu lagi, karena saya yakin teman-teman semua sudah tidak sabar mau sama-sama mendengarkan sharing ilmu dari seorang pakar kalau saya bilangnya. Jadi nanti simak baik-baik, kalau ada pertanyaan kita akan diskusikan di akhir sesi. Dan untuk yang kami masih terus membuka karena ini masih terus bertambah peserta yang masuk. Ya, dan ini juga ada peraturannya mungkin sebelum saya mulai bahwa peserta yang akan mendapat e-sertifikat adalah mereka yang stay di webinar ini minimal 75%. Ya, nanti itu akan kita seleksi karena kita punya sistemnya jadi kita bisa lihat. Oke, karena kita kan pengen di sini teman-teman semua, rekan-rekan semua mendapatkan ilmunya, bukan hanya dalam tanda petik ngejar SKP-nya gitu ya. Oke, jadi karena ini saya yakin sangat bermanfaat ilmunya untuk di pelayanan kita di pasien nanti. Oke, untuk memasuki acara yang pertama, kita akan mendengarkan bersama-sama lagu Indonesia Raya, Mars PPNI, dan Mars InWOCNA. Dipersilakan. Mars PPNI.
Persatuan Perawat Nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Mendapatlah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk mengantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, mencapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Mars InWOCNA.
Himpunan perawat Luka, Koma dan kontinen selalu siap hadir di sisi pasien dan keluarga. Rela hati tapakan kaki untuk melayani seluruh negeri, wujudkan kepedulian sehat kepada sesama umat. Putih hatimu kibarkan semangat kerja, berbasis bukti kembangkan diri. Untuk Indonesia kibarkan kemampuan nyata di mata dunia, dengan gelora semangat berkarya. Tak kenal lelah, tepiskan aliran peluh, tulus ikhlas dalam setiap layanan. InWOCNA bangkit, InWOCNA jaya, menuju Indonesia sehat sejahtera. Himpunan perawat Luka, Koma dan kontinen selalu siap hadir di sisi pasien dan keluarga. Rela hati tapakan kaki untuk melayani seluruh negeri, wujudkan kepedulian sehat kepada sesama umat. putih hatimu, kibarkan semangat kerja, berbasis bukti, kembangkan diri. Untuk Indonesia, kibarkan kemampuan nyata di mata dunia. Dengan gelora semangat berkarya, tak kenal lelah, tepiskan aliran peluh, tulus ikhlas dalam setiap pelayanan. InWOCNA bangkit, InWOCNA jaya, menuju Indonesia sehat sejahtera.
Sampai 5.000 aja lah untuk stok. Ya memang harus stok segitu. Nah, saya akan kami masih terus menunggu peserta yang masih akan bergabung karena kita masih ada slotnya. Mungkin saya perlu bacakan kembali karena ini kita memakai webinar jam, jadi cara masuknya memang sedikit berbeda. Anda yang sudah melakukan registrasi akan mendapat email, ya, email dari InWOCNA. Nah, nanti tinggal klik buka email Anda tersebut, kemudian di dalamnya akan ada link. Nah, link itu tinggal diklik dan Anda akan bisa masuk langsung ke webinar jam kita hari ini. Mungkin banyak teman-teman dari rekan-rekan yang sudah masuk sekarang, masih ada teman-temannya yang belum bisa masuk, bisa diinfokan bahwa dia harus membuka link ini dari email yang kami kirim dari InWOCNA pada saat dia selesai registrasi dengan sempurna. Ya, jadi kemudian yang tadi saya ulangi lagi bahwa kami akan memberikan e-sertifikat kepada para peserta yang 75% mendengarkan dan ikut dalam sesi webinar ini. Dan email akan kami kirim melalui email Bapak Ibu. Paling lambat waktunya adalah 2 minggu dari webinar ini kita selenggarakan. Dan materi nanti saya akan tulis linknya di chat biar Bapak Ibu bisa mendownload materi kita semua, bisa di chat. Di link ya, nanti saya kasih linknya di akhir acara. Oke, itu saja untuk saat ini. Kita masuk ke acara berikutnya, yaitu saya akan mengundang, karena kita hari ini, kita beruntung sekali ya, DPW InWOCNA DKI Jakarta bisa bekerja sama dengan salah satu perusahaan yang juga setia dengan kita-kita nih yang berkecimpung di dunia luka, stoma, dan kontinens, yaitu dari SCT. Jadi kita akan meminta nih ya untuk pembukaan ini sambutan dari Marketing Director perusahaan SCT yaitu Ibu Joyce Simanjuntak. Kepada Ibu Joyce kami persilahkan.
Selamat pagi, Bapak Ibu. Greetings to our distinguished speaker, Dr. Emily Haesler from Australia. Yang terhormat juga Ibu Pembicara kita, Ibu Eka, dan juga Bapak Adik. Dan juga untuk Ibu Moderator kita hari ini, Ibu Ria. Selamat pagi bagi Bapak Ibu seluruh peserta webinar. Terima kasih kalau pagi hari ini di tengah hari Minggu seperti ini Bapak Ibu meluangkan waktu demi mengupdate dirinya untuk mendapatkan pengetahuan yang tentunya bermanfaat bagi Bapak Ibu. Luar biasa. Perkenalkan, nama saya Joyce Simanjuntak, saya Marketing Director dari SCT Indonesia. Salam sehat dari kami semua di SCT. Pertama-tama perkenalkan saya mewakili rekan-rekan saya di SCT Indonesia, Bapak Ibu, untuk mengucapkan terima kasih dan penghargaan kami yang setinggi-tingginya kepada Bapak Ibu petugas kesehatan yang sudah luar biasa menjadi garda terdepan dalam situasi seperti saat ini. Kiranya Bapak Ibu selalu diberikan kesehatan dan juga keberkahan. Saya juga mengucapkan terima kasih yang tingginya kepada PPNI dan juga InWOCNA atas perkenanannya sehingga kita dapat bekerja sama untuk dapat mewujudkan kesempatan hari ini, webinar hari ini, demi pengetahuan keperawatan berkelanjutan, terutama dalam topik yang sangat erat kaitannya dengan keadaan pandemik saat ini. Pressure injury in COVID-19 pandemic, a comprehensive update, prevention and management. Dalam berbagai aspek kehidupan luar biasa ya Bapak Ibu ya, COVID-19 ini memiliki efek yang sangat terasa, terutama bagi kita para pelaku kesehatan di dunia kesehatan. Pressure injury merupakan masalah yang sering ditemui dalam kehidupan sehari-hari, bahkan lebih lagi menjadi perhatian di masa situasi sulit seperti ini. Penanganannya menjadi sangat penting untuk diperhatikan. Dan bukan hanya kepada para pasien kita, tetapi juga kepada para rekan-rekan kita petugas kesehatan, di mana setiap waktu menggunakan APD yang cukup ketat ya Bapak Ibu ya, kemudian juga menggunakannya dalam waktu jangka waktu yang panjang atau lama, berjam-jam, minimal 8 jam. Sudah bisa juga kita lihat dari banyaknya report atau laporan yang masuk yang melaporkan bahwa banyak sekali terjadi pressure injury pada bagian wajah, terutama bagi para rekan-rekan tenaga kesehatan. Cukup memprihatinkan karena itu menyebabkan resiko mereka menjadi sangat tinggi terpapar atas penyakit yang lain. Kami dari SCT Indonesia juga berkomitmen untuk tetap berkontribusi bagi situasi yang kita hadapin. Tentu saja selain donasi kepada rumah sakit yang kami lakukan di berbagai rumah sakit di seluruh Indonesia, terlebih dari itu adalah kami mendedikasikan produk-produk kami yang dapat digunakan untuk dapat melindungi para rekan-rekan petugas kesehatan sehingga dapat membantu menurunkan resiko yang lebih lanjut dari penggunaan APD. Rangkaian produk kami didesain maksimum untuk dapat membantu para petugas kesehatan dan juga tentunya membantu para pasien kita dalam perawatan luka modern. Besar harapan kami agar melalui webinar ini Bapak Ibu dapat terupdate, terutama pembicara kita luar biasa ya hari ini, ada Dr. Haesler, ada Ibu Eka, ada Bapak Adik, itu luar biasa. Beliau akan menyampaikan topik yang luar biasa, saya juga sudah tidak sabar untuk mengikutinya, dan kiranya kita semua dapat bersama mengupdate ilmu pengetahuan kita dari beliau-beliau yang super ini. Baiklah, ini saja dari saya mewakili SCT Indonesia. Kiranya Bapak Ibu dapat mengikuti webinar hari ini dan kiranya bermanfaat dan tentunya dapat diaplikasikan secara praktis dalam praktek keperawatan sehari-hari demi tercapainya kualitas hidup manusia Indonesia sehat. Selamat mengikuti acara webinar, sukses selalu dan maju terus perawat Indonesia.
Terima kasih kepada Ibu Joy Simanjuntak selaku perwakilan dari SCT. Beliau adalah Marketing Director. Terima kasih sekali kerjasamanya ini luar biasa ya, akhirnya bisa terselenggara. Nah, untuk selanjutnya sekaligus membuka acara internasional webinar kita, saya akan mengundang Bapak Suryadi selaku Presiden InWOCNA atau Indonesian Wound Ostomy and Continence Nurse Association. Kepada Bapak Suryadi kami persilakan.
Thank you, Moderator, Ms. Ria Andjarwati. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. So first of all, I would like to say welcome to the international webinar presented by Regional Jakarta, the Wound Ostomy Continence Association, collaborate with the ICT company. This is interesting international seminar with themes pressure injury in COVID-19 pandemic, a comprehensive of prevention and management. Distinguished guests, our speakers from Australia, Dr. Emily Haesler, welcomes Eka Widiati from Cipto Mangunkusumo Hospital, and Mr. Andi Hidayat from Indonesia also. I would like to express my gratitude and appreciation to all of you, and thank you for taking time to share the knowledge in these events. And also I would like to thank you the SCT teams that supported this event. It's very wonderful, and also hopefully all participants can enjoy and also can get new knowledge with this event. And finally, we hope all participants would enjoy during this event. And also, I open this ceremony with say Bismillahirrahmanirrahim. Thank you.
Well, thank you, Pak Surya, for welcome speech. Baik, Bapak Ibu, kita akan mulai sesi presentasi hari ini. Please of all, I would like to invite our guest speaker, our first speaker, Dr. Emily Haesler. Welcome, Dr. Emily. Are you on now?
Yes, I'm online now.
Well, I haven't seen your picture. Yeah, so everybody can see you. Hi, how are you?
Good morning, everybody.
Morning. Oh, it's so nice to meet you this morning.
And you too. Thank you to everybody for coming online. And thank you for the Indonesian Wound, Ostomy Incontinence Nurses Association and SCT for organizing this wonderful event.
Yes. Okay, Dr. Emily, first of all, I would like to read your CV. Your CV, I will share the screen, okay? Sorry. Yes. Dr. Okay, everyone can see Dr. Emily Haesler. So I will read your CV in Indonesia, Dr. Emily, because you have a great CV. It's 17 pages, but I think I will.
Oh, you can read the brief version.
Yes. Oke, saya akan bacakan kurikulum Dr. Emily dalam bahasa in bahasa, oke, Dr. Emily. Dr. Emily adalah asisten profesor di Curtin University School of Nursing and Midwifery. Beliau bekerja di bagian penelitian unit manajemen dan penyembuhan luka, termasuk pendidikan untuk tenaga klinis dan penelitian luka translasional. Dr. Emily juga menjadi salah satu metodologis untuk International Pressure Injury Guidelines, ya, ada NPIP, terus European sama Asia Pasifik. Sejak tahun 2012, beliau aktif sebagai koordinator project, mengevaluasi penelitian dan advisor untuk guideline governance group di kelompok-kelompok pengembangan untuk pressure injury. Nah, beliau juga sebagai editor di Journal Wound Practice and Research. Beliau duduk sebagai ketua komite di International Wound Infection Institute dan di World Alliance for Wound and Lymphedema Care. Saat ini beliau sudah mempubliskan lebih dari 100 peer review manuskrip dan lebih dari 60 di bidang pressure injury dan luka kronik. Dr. Emily juga telah mendapatkan tanda dosen kehormatan di Australian National Medical School, Academy Unit of General Practice, dan di La Trobe University. Nah, saat ini beliau tinggal di beautiful city Canberra, Australia. Okay, I think it's all your CV, Dr. Emily. I resume it.
Thank you for that lovely introduction.
Well, I just want to say to the audience that your topic today would be so. Oh, okay. Are you clear with my voice?
Yes, I'm clear with your voice. Can you hear me well?
Yeah, I can hear you, but some of the audience cannot hear my voice. Aku yang chat. I will ask the audience first if they can hear my voice clearly, and then I will continue. Okay?
Okay.
Because right now our voice is very important. Okay, sudah. Okay, suara. Okay, the sound is clear now. So I would like to the audience that they very luckily because this morning we can get the knowledge and also maybe tips and tricks from the expert because I read your CV that you are really specialized in pressure injury.
Yes.
So today, please take your time to share the knowledge and we will discuss after all the session. So for the audience, if you have any question, you can write down to the chat. In Bahasa, it's okay. I will translate to English. Okay? Please, Dr. Emily, your time to present.
Thank you. Are you going to run the slides? Yes, lovely.
Yes, yes.
So good morning to everybody who's online this morning. After that lovely introduction, you know, my name is Emily Haesler. I'm from Curtin University in Australia. And at Curtin, I'm one of the lead professors at the Wound Healing and Management Unit, where I conduct research on wounds and most particularly into pressure injuries. And I do a lot of work developing education material for wound nurses. And I also have a lecture position in the academic unit of general practice at the Australian National University. So this morning I'm going to talk to you about pressure injury prevention during COVID-19 pandemic, and I'm going to have a focus on preventing pressure injuries in your patients. I know that pressure injuries are now becoming a big concern for staff, and I think one of our other presenters today is going to talk about personal protective equipment, and I think that the topic of preventing your own pressure injuries will come up in that talk. So my background is as the methodologist for the International Pressure Injury Guideline, and the third edition of this guideline was published in November 2019. And the Indonesian Wound Ostomy Continence Nurses Association was an associate partner in the development of this guideline, and they're currently doing a translation of the guideline into Indonesian. Briefly today, I'm going to give you some background information on COVID-19 prevalence and its management, and then I'm going to talk to you about the pathology of COVID-19 and how that influences pressure injury risk. And then I will talk to you about some tips and tricks for managing patients in hospital with COVID-19, and also a little bit of discussion about your care teams. So as of yesterday evening, worldwide there was 927 cases per million of COVID-19 and 55 deaths per million people, which is an approximate death rate of 6%. So where are these cases? This map shows you the spread of coronavirus, with the dark purple countries having reported higher numbers. And as you'll understand, these figures are influenced by the rate of testing for COVID-19 in different countries and the types of patients who are receiving testing. So they may not accurately reflect case numbers, but they do provide for us an idea of which countries have high numbers of critically ill patients. So here is the Indonesian figures from last night, and also showing your surrounding countries. There's a much higher rate in Malaysia and a lower rate of COVID-19 in Thailand. And the cases in Indonesia are currently still climbing, and you're currently at 117 cases per million people. I'm sure that you're all well aware of the presentation signs and symptoms for these patients. There's a wide spectrum of illness from asymptomatic to severe pneumonia and respiratory disease and death. And patients will most often present with signs and symptoms of infection and upper respiratory tract infections specifically. And laboratory results for these patients show signs of infection, so leukopenia and lymphopenia, and signs of inflammation, elevated inflammatory markers such as C-reactive protein. When we look at the spectrum of disease and its management, people with mild illness and no respiratory difficulty are monitored. They are more likely to be monitored at home in most countries to reduce the impact on the healthcare system. So patients with moderate and severe illness, and they're in the middle here on my table, they are classified by their oxygen saturation levels for severity, and they're generally admitted to hospital in isolated rooms and managed with strict infection prevention and control measures and antibiotic therapy and oxygen therapy. And more severe patients suffer acute respiratory distress syndrome, elevation in multiple inflammatory markers, and cytokine storm. And if they have comorbidities, these will be exacerbated. So these patients are managed in the with an ICU admission. They might need vasopressors, high-flow nasal cannula, oxygen, and possible intubation and mechanical ventilation. So this information here is from the Center for Diseases in the US, and I've got references at the end. So the factors that I've just outlined, the presentation of COVID-19 and the way that it's clinically managed, all have negative consequences for the risk of pressure injuries. And additionally, the challenges that the health systems are facing around the world also raise new factors that can influence whether a patient will get a pressure injury. So when all these factors are combined, we can see that patients with COVID-19 requiring a hospital admission, they're very vulnerable to pressure injuries. So I'm just going to briefly discuss the etiology of pressure injuries and how COVID-19 pathology interacts with this, and how this interaction increases pressure injury risk for our patients. So we often think about pressure injury etiology with respect to factors on the outside of the skin that increase the risk of skin breakdown, so pressure, moisture, and friction. But there's also internal processes that occur when cells become damaged or die from sustained tissue deformation forces. And in simple terms, when pressure from sustained body weight forces occurs, the cells in the soft tissue become largely deformed and they start to die. And this is exacerbated by reduction in vascular supply caused by pressure force on the blood vessels. And so when multiple cells start dying, the damaged cells release pro-inflammatory cytokines and they create an immune response. This immune response causes dilation and increased permeability of capillaries, and this leads to plasma fluid leaking into the interstitial tissues, which causes tissue edema. And swelling of tissues can increase the effect of external pressure forces. So for patients with COVID-19, the cytokine release or the cytokine storm that they experience can exacerbate this immune response, and that further increases the risk that they will develop a pressure injury. So Professor Geffen from Israel, his previous chair of the EPUAP, he's described this etiology in an upcoming paper to be published in the Australian Journal Wound Practice and Research in June. So look out for that on the Wounds Australia website. So the international guideline notes that abnormal laboratory results are a potential impact on pressure injury risk, and specifically inflammatory markers such as C-reactive protein, which are noted to be elevated in patients with COVID-19, have been significant in prognostic studies exploring pressure injury risk. So next, we understand that patients with COVID-19 have reduced and sometimes critical respiratory function. So this leads to low oxygen saturation, which exacerbates the effects of tissue ischemia. And for patients with cardiac comorbidities, there can be additional factors such as reduced cardiac output that create further complications leading to tissue inflammation and eventual cell death. So the international guideline notes that impairment to perfusion, circulation and oxygenation increases the risk of pressure injuries. And prognostic studies have identified that having a respiratory disease, using oxygen or having mechanical ventilation are all variables that are associated with an increase in risk of pressure injuries. So we also understand that patients with COVID-19 often exhibit fever, and that potentially with increased perspiration. So a rise in the body temperature and the skin moisture are also both recognised risk factors for pressure injuries. So from this outline, I hope you can see that the disease process of COVID-19 exacerbates the etiological process of pressure injuries and increases the risk that a hospitalised patient with COVID-19 will experience a pressure injury. So in addition to this, the management for COVID-19 also presents additional risks for pressure injuries. And so first, we see many severe COVID-19 patients are having an extended hospital stay, and a longer duration of time in the critical care setting is shown in prognostic studies to be associated with an increased pressure injury risk. Most hospitalised patients with COVID-19 will receive oxygen therapy, and they will be using any number of delivery methods, including potential mechanical ventilation. Receiving mechanical ventilation is associated with an increased risk for pressure injuries in prognostic studies, and the risk of pressure injuries associated with medical devices, and that includes your nasal cannulas, tubing and masks, that the risk for pressure injury is very well documented. So in patients with critical illness and severely low blood pressure, as a patient with severe COVID-19 will have, often medications known as vasopressors are used to manage critical illness and severe low blood pressure, which can occur during sepsis. And this medication, vasopressors, are vasoconstricting medication. And there's increasing evidence that using vasopressors is associated with pressure injury risk because they contribute to a decrease in blood circulation to the skin and the extremities while preserving blood flow to the vital organs. So the international guideline identifies that the use of vasopressors is a factor associated with an increased risk of pressure injuries for patients in critical care settings. And finally, placing the patient in the prone position improves ventilation perfusion ratios and reduces the strain on lung tissues. So it's often used for COVID-19 patients. And there's about 8 RCTs that have shown that prone positioning will improve oxygenation for patients with acute respiratory distress. And it also is associated with a reduction in mortality. So we see many COVID-19 patients are placed in the prone position, and that will be usually for 12 to 16 hours per day. However, we need to be aware that using the prone position is considered to increase the risk of pressure injuries. Now, in some countries, and I'm sure some places in Indonesia will be experiencing these factors, health systems are facing great challenges with the health workforce and equipment. For example, in Australia, tissue viability nurses, many of them have been redeployed to other working areas in the hospital and the health system. And this has reduced the access of nurses to specialist knowledge on pressure injuries. And in some areas, the healthcare staff are working in critical care settings where they have limited experience or they have not worked in that setting for a long time. And these staff have less experience and knowledge about practices to reduce pressure injuries. So in the international guideline, there's a discussion about how cohesion and teamwork of the workforce and having a positive attitude in the team to reducing pressure injuries is significant in reducing the prevalence of pressure injuries. So with the reassignment of staff members that many hospitals are seeing, there's a risk that positive work teams who care for critical patients and the positive effects that they've achieved in the past will now have less focus during COVID-19. And finally, we have a burden on the healthcare system in most countries that reduces access to pressure injury equipment, such as specialist pressure redistribution support surfaces, which we know are crucial to preventing pressure injuries. So the 2 areas that most increase the patient risk of pressure injury that I'm going to talk about most today are positioning and medical devices. And these 2 illustrations show in red the pressure injury risk points for contact between the skin and an external source of pressure. For example, in these photos, the support surface and the oxygen mask. And here I'll mention that the model wearing the mask is my son, Patrick Haesler, and he's a music composer. And in order for him to pose for this photo, he asked that I let you know that you can follow him on Spotify or your favorite music platform, and you can find his song about COVID-19 that's called Virus Killer. So thank you, Patrick, for that modeling. So first of all, I'm going to just discuss some general tips for reducing pressure injuries. First, it's vital that you protect yourself and your team, but I won't discuss the requirements for personal protective equipment because there's another presentation today that's going to be dedicated to this. But protecting yourself and your team is the #1 essential tip for caring for patients with COVID-19. So we all know that the first important step is to screen your patients for pressure injury risk. And given the background pathology that I've just discussed, it's clear that patients with COVID-19 will have an increased risk and they'll require a formal pressure injury risk assessment when they're admitted and also when their clinical condition changes. So assessment of the skin and soft tissue should be conducted with every risk assessment and then regularly thereafter. And this is usually done when the patient is repositioned or when hygiene is attended. And you need to pay particular attention to bony prominences when you do that skin assessment. When assessing the patient, make an individualised pressure injury prevention plan with care goals. And it's important to involve the patient and their family and make them aware of the parts of their care that are about reducing pressure injuries, because when that patient starts to recover, they'll be able to be involved in their own pressure injury prevention, for example, through early mobilisation and for moving more regularly to reduce pressure. So it's important that your patient and their family understand that some of the care that you're delivering is about pressure injuries and not about COVID-19 necessarily. And finally, it's important to bundle your care delivery. Performing all your tasks at the same time will reduce your own exposure to the patient and to COVID-19, and it will also minimise the disruption to hemodynamic and oxygen status of your patient. So before I talk about repositioning, I'll just mention that the use of high specification pressure redistribution support surfaces is essential. And this can be a high specification foam mattress, or for some patients, if you have available, an alternating air pressure mattress, if you have one in your hospital. Some facilities might have the luxury of a bed specifically designed for prone position, and these are beds that will rotate the patient from 40 to 60 degrees, and that assists with drainage of pulmonary secretions. These beds are not very common in Australia, and I'm sure they're probably not very common in Indonesia either. So regardless of the type of support surface that you use for your patient will need to be repositioned to reduce pressure. If possible, avoid using extended periods in the prone position. But for most COVID-19 patients being managed for acute respiratory distress syndrome, the prone positioning will be used for up to 16 hours a day. So we need to be very diligent in relieving pressure as much as possible. You can rotate the patient between the standard prone position and the swimming position, which I've shown here, and you can rotate the swimming position from left to right as well. You need to reposition your patient's head every 2 to 4 hours or more if it's requested or required by that patient. And you need to pay particular attention when you're positioning the head to your patient's ears. Make frequent small shifts of the individual's body position if full repositioning is not possible, or to supplement your regular repositioning. Some COVID-19 patients who are very critical, repositioning can disrupt their hemodynamic status. So it might be very difficult to regularly fully turn your patient, but you can use very small maneuvers to shift the patient's body weight and do that very frequently to change the point of the body that's experiencing the most force. This means you might tilt the patient slightly to relieve the pressure rather than turning the patient fully to the opposite side. And regularly making these small shifts of body weight might be the only way that you can reposition a critical care patient, certainly in the beginning of their admission. You need to reposition critical patients using very slow and gradual turns and assess their hemodynamic and oxygen response and allow time for that to stabilise before you leave the patient. So to achieve this, you might need more staff members to assist in the turning, and you need to be very diligent to lift rather than drag the patient, because dragging will create friction force that again increases the risk of pressure injury. There's a wide range of specially designed repositioning devices to offload pressure points, or you can use regular pillows. However, you need to think about the equipment that you're using at this time and remember your infection control principles. Can the equipment that you're using be sterilised, or will you need to dispose of it afterwards? You shouldn't share pillows or repositioning devices or manual handling equipment between your patients with COVID-19. And finally, each and every time you reposition the patient, check for uneven pressure distribution and the way medical devices are positioned. So in the next few slides, I'm going to discuss each anatomical area of the body. And although the tips that I'm going to give you are specific to the prone position, many of them or most of them are relevant to a patient in any position. We need to pay attention to the patient's head, manage the sources of moisture, particularly when they're prone, because when they're in a prone position, oral secretions and perspiration can build up very quickly. We need to suction oral secretions and regularly attend to the patient's facial hygiene. You can consider to use a soft multi-layered foam prophylactic dressing, and that can be applied at pressure points on the face, but it should be changed very regularly when moisture builds up. The soft silicone foam multi-layered dressing is less traumatic to the skin when you're replacing it than other dressings such as transparent film that are sometimes used to protect the skin. So you also need to use offloading devices to offload the patient's head and face. When you select your device, you need to consider the foam density and the support that it's going to provide. You need to consider the height of the pillow so that the patient's neck alignment is maintained. And you also need to consider the angle of the patient's face and the devices that are being used on the patient when you select an offloading device. If the patient is in prone position, you can use facial gel pillows, similar to what is used in the operating room, if you have access to that. So when your patient is in the prone position, the head should be shifted at least every 2 hours and completely repositioned at least every 4 hours. But some patients might require more regular pressure offloading than this. Assessing the skin regularly for pressure damage is key to selecting the repositioning frequency for each patient. You need to consider positioning of medical devices and the type of endotracheal tube securement that you're using. Some ETT tube securements can increase the pressure when the patient is in manual position, manually proned position. So in this case, use a secure tape for the ETT tube. Prevent pressure damage to the patient's mouth. You might need to use a soft bite block, which I have shown there on the screen, to prevent mouth damage in the prone position. Remember to inspect the mucous membranes and the tongue to see that there's no pressure damage inside the patient's mouth. You also need to remember to care for your patient's eyes to prevent corneal abrasion, and you can do this with ophthalmologic lubricant or eye drops, and taping the patient's eyelids shut to prevent eye damage when they're in prone position. So next we need to pay attention to the patient's torso area. The pressure points of the torso include the clavicle and the breasts, the genitalia, and the pelvic bones. And you need to consider once again that you can use a soft silicone foam multi-layered prophylactic dressing if you have access to that product to protect those pressure points. But you will need to remember to prepare the patient for repositioning before you reposition. This means ceasing enteral feeding for about 1 hour before you reposition the patient, and then recommencing it once the patient has been stabilized. You can position the patient using pillows or offloading devices, but be aware of the location and position of lines and devices. You need to secure central lines and cannulas away from the patient's skin. And some positioning devices, for example, the gel cushion, you can make little tracks in the gels so that the tubes can sit deeper and they won't be touching the patient's skin. So think about making channels in gel cushions or regular cushions for the tubes and lines. If possible, you can relocate some of those medical devices. For example, the EKG leads on the patient. When they're in prone position, you can put them on the patient's back instead of the chest. For colostomy devices, you need to regularly empty the pouch and protect the stomal area. Regularly emptying the colostomy pouches prevents pressure from fecal material building up, and it also reduces the risk of moisture and chemical irritants from fecal material. And so remember, when you position your patients in prone, to make sure that ostomy bag is as empty as possible. And also, of course, remember to check the positioning of the patient's genitalia, because these tissues are very sensitive and often we overlook positioning in this area. And remember, I said before, to bundle your care. So change the colostomy bags, adjust the lines and devices, all at the same time that you reposition the patient, to reduce the number of interactions that you need to have with that patient. So we also need to pay attention to the patient's limbs, and particularly their lower limbs. Once again, you can use a prophylactic dressing to pressure points, such as the patella and the pretibial areas. But you need to remember that a prophylactic dressing can protect the skin, but you still need to regularly assess skin damage underneath that prophylactic dressing. So if you don't have the prophylactic dressings to use, you need to keep the skin clean, gently moisturize, but don't massage, because massage increases friction and that increases the risk of a pressure injury. So once again, for the lower limbs, pay attention to the location of the tubes and lines, and remove catheter securements when the patient is in the bed, because they can pull on the skin and create a pressure risk. The patient's feet also need support. So in the prone position, consider using a rolled up towel underneath the patient's ankle to relieve the pressure on the top of the foot. But if the patient is in the supine position, you can use heel offloading devices, or a device that supports the whole length of the patient's calves, because you want to prevent pressure on the Achilles tendon region. And finally, you need to remember to check your patient each and every time you reposition. You need to check for even pressure distribution. You need to check for other unsecure items that might be in the bed. For example, it's very often that you put down the needle cap, your pen, the Yanker sucker on the side of the patient's bed, and these can accidentally roll under the patient and create a risk from a device that's not a medical device. So be careful about the other things that can accumulate in a patient's bed. Almost all patients with COVID-19 who are admitted to hospital will need some level of oxygen therapy. And this might be through a nasal cannula, or it might be through a high flow oxygen mask, or intubation and mechanical ventilation. And less often, because it's not actually recommended for COVID-19 patients, but less often, extracorporeal membrane oxygenation device. Additionally, for critically ill patients, they're likely to have many of tubes and lines, a CVC line, for example, the lines that I've already discussed. And it's important to assess the skin under and around all medical devices. And this means, when possible, to lift the device or remove the device if you can, to visualize the skin well underneath it. You need to monitor.
Sorry, 3 more minutes.
Okay.
Sorry.
You need to monitor the securement devices. Here in this picture, you can see the securement device is very tight, and that will be creating increased pressure risk, which is very important with COVID-19 patients who, as I said before, might be experiencing some edema. So if you have available, you can use a thin prophylactic device, but you need to be careful not to put too much underneath the medical device or the securement, because too much dressings underneath will increase the pressure. So lastly, I'll just remind you a little bit about the importance of supporting your care team. With health professionals redeployed into areas they're less familiar with, you, as experts, need to make sure that you support the education of your team, access new education and provide that to your colleagues. And remember that they are going to take information that they learn from a different care setting back to their own care settings. As we know, all patients in all clinical care settings are at risk of pressure injuries. Finally, some of your health facilities might not have enough equipment. It's a good time to campaign for more equipment, but you need to consider resource allocation and assigning patients with high pressure injury risk more advanced support surfaces and offloading devices if you have them. So be creative with your pillows and rolled towels, but don't use IV bags or donut rings, because these are associated with an increased risk of pressure injuries. And remember, don't share devices between your patients during COVID-19. So I just wanted to quickly let you know of some great resources that are available at the moment. The NPIAP website has more resources about preventing pressure injuries for COVID-19 patients. The EPUAP Facebook page has open access page for anybody who requests, and there are lots of health professionals all around the world sharing their own tips and tricks in that Facebook page. And in the Pan-Pacific region, the PPPIA team are just about to release flowcharts and some classification tools specific for the Pan-Pacific region. And of course, if you haven't already got a copy, you can access the International Pressure Injury Guideline from the guidelinessales.com website. And there's a free abridged version of the quick reference guideline that you might want to look at. And also this team is currently developing an app for the pressure injury guidelines, so look out for that later in the year. So thank you for listening to my talk, and I hope that that's been helpful for you to develop a few tips and tricks on what you might do managing your patient with COVID-19. Thanks, everybody.
Okay. Okay, Dr. Emily.
Can you hear me?
Yes. Okay. So you finish your presentation?
Yes, all finished. Thank you.
Okay. Thank you for the great presentation. I note some important things from your presentation, that COVID-19 pathologies and management is so connected with pressure injury. Have a big impact to get to the pressure injury risk. And also, I put some notes that a lot of tips that you give, maybe our audience will ask that in the session. I already talked to the chat that they can write down the question, and we will discuss after the last session. Okay.
Yes. Thank you.
You stay tuned. Okay.
I'll stay tuned. Thank you.
Yeah. Our next speaker will say in Bahasa, but the slide will be in English.